All right, so we're going to continue on here with 18.2. Oops, what page is this? On page, let's see, that's not right, 788. All right, so the second section of our blood chapter, cardiovascular subsection blood. So we're going to talk now about the production of the formed elements. So we talked about the blood plasma, now we're moving on to the formed elements. So the lifespan here, starting here, is very brief. So they don't last for very long, and we'll talk about the different lengths of time that each one of them lasts. So although one type of leukocyte called the memory cells can survive for years, so that's kind of the exception, or the memory cells. Because those are, well, we'll talk about them in the white blood cells. Let's not get ahead of ourselves. So most erythrocytes, leukocytes, remember that's red blood cells, white blood cells, and platelets, normally live only a few hours to a few weeks. So that's their kind of time frame from birth to death there. Thus, the body must form new blood cells and platelets quickly and continuously. So when you donate blood, for example, in a blood drive, which is about 1 pint, your body typically replaces that donated plasma within 24 hours. So our body is pretty quick to make new elements there so that it can continue doing its job efficiently and effectively. But it takes about 4 to 6 weeks to replace the blood cells. So the plasma part, right, the part that allows us to flow and get everything to where it needs to go, takes only about 24 hours. But it does take 4 to 6 weeks to replace all of those erythrocytes and the white blood cells. The white blood cells take a little bit longer as well, and the platelets there. So this restricts the frequency which you can contribute blood, right? So you can't do it every day, otherwise you wouldn't have enough blood cells, and that would be very dangerous. So the process by which this replacement occurs is called hemopoiesis or hematopoiesis, and I may switch between the two of those. Our text mostly uses hemopoiesis, though. When I was studying these things, I used hematopoiesis, so I may use both there. So the sites of hemopoiesis, prior to birth, hemopoiesis occurs in a number of tissues. So beginning with the yolk sac, and we're going to talk a lot more about the formation of a fetus at the very, very end of the semester. So we can talk more about that, and will when we get there. So this is generally. Begins with the yolk sac of the developing embryo. And then it continues in the fetal liver, spleen, lymphatic tissue, and then eventually the red bone marrow. So then once the fetus is born, so following birth, most of the hemopoiesis then occurs in the red bone marrow. And as a reminder, going back to your bone section in 271, a connective tissue, right, the red marrow is a connective tissue within the spaces of the spongy bone tissue. So if you remember, it's kind of looks like a sponge. It's got all of those little holes in it. That's the spongy bone tissue, and that's where we have our red bone marrow or red marrow in there. So in children, hemopoiesis can occur in the medullary cavity of the long bones, and you probably spoke about that in first semester A&P. And in adults, the process is largely restricted to the cranial and the pelvic bones. The vertebrae, the sternum, and the proximal epiphysis of the femur and the humerus. Again, you probably should have spoke about that in the bone section, in the skeletal section. So throughout adulthood, but that's something that you do need to know for this chapter. Let me not just brush that off, but you do need to know these things. It's just kind of a reminder. Throughout adulthood, the liver and the spleen maintain their ability to generate the formed elements, and this is referred to as the extramedullary hemopoiesis. So extramedullary, extra meaning outside, and medullary of the medullary cavity of the adult bones. So hemopoiesis means blood, making of the blood, right? The process of blood making, and extramedullary, outside of the medullary cavity of the adult bones. When a disease, such as bone cancer, destroys the bone marrow, causing hemopoiesis to fail, then that's when this extramedullary hemopoiesis may start up. So if there's a problem with the red bone marrow, then this section, the extramedullary hemopoiesis, is going to start up and try to help the body to limp along there until hopefully something will happen with the red bone marrow to help get it back online. All right, so we're going to talk about the differentiation of the formed elements from stem cells now. So hopefully you recall that stem cells are those initial cells from when there is a developing embryo. We have stem cells, and there are various stages or levels of stem cells. So we'll talk a bit about those different levels or different stages, or the hierarchy, as it were, of stem cells that are related to the formed elements here. So all formed elements arise from stem cells of the red bone marrow. Here, a little recall that stem cells undergo mitosis plus cytokinesis to give rise to new daughter cells. So if we're talking about a cell, remember it's going to divide, that's the mitosis. Well, the mitosis is the division of the insides of the cell here, and then cytokinesis is when it separates into the two cells. So here, one of these remains a stem cell, so this is going to go back up and kind of be this guy's replacement, which doesn't exist anymore because it just split into two. And then the other one, this guy over here, is going to then move on and differentiate into a number of diverse cell types, and those are the ones that we'll be talking about. So we have our initial stem cell here that's going to become a stem cell, and then one that goes on to make whatever formed element we're talking about, or the next eventually that cell. You know, there are various stages in here. So stem cells may be viewed as occupying a hierarchical system, that's what I was talking about, with some loss of the ability to diversify at each step. So that's saying that this very first stem cell can turn into many things, but once it has gone down this particular process, it's then at each step of the way is going to turn into something very specific. It gets more and more specific as it goes. So a little about that. There's the totipotent stem cell, so that's right here, and that's the zygote or the fertilized egg. So that would be, well, here's a picture. I don't have to draw one. So we have our, no, that's not it. So we'll have our totipotent cell here, which is our fertilized egg. So the very first stem cell here at the top, which can change into all. So here toti meaning, or tota meaning all, gives rise to all the cells in the human body. Then the next level is the pluripotent stem cell, which gives rise to the multiple type of cells in the body and some of the supporting fetal membranes. So then we're moving down a level. This is the, so we can write up here, this is the totipotent cell, and this is the pluripotent cell. And then this gives rise to multiple types here. So beneath this level, beneath the pluripotent level, is the mesenchymal, where is that? There it is, mesenchymal cell. So we can just say that's short there. Mesenchymal cell is a stem cell that develops only into types of connective tissue. So if you remember back to 271, talking about the tissues, which should have been one of the first kind of systems that you talk about, remember the mesenchymal cell is the beginning of all of the different types of connective tissue. And then if you remember, when you divided connective tissue up, it included fibrous connective tissue, bone, cartilage, and blood, right? But not these epithelium, muscle, and nervous tissue. Those were different. So one step lower on the hierarchy of stem cells is the hemopoietic stem cell. So going back to this hemopoietic, right, which is the stem cell, right, the stem cell that's going to take over the process of making blood. So then we have our hemopoietic stem cell, hemo, or the hemocytoblast. So those are all things that you need to know. You need to know that totipotent is the top here, then we go to the pluripotent cell, then we go to our mesenchymal cell, which is developing into the different types of connective tissue, and then we have our hemopoietic stem cell, which is called, and you should know that, as our hemocytoblast, and that's kind of where we can go back up to where this hierarchical chart starts. So hemopoiesis begins when the hemopoietic stem cell is exposed to the appropriate chemical stimuli. So we will talk about these called hemopoietic growth factors. We will talk about those in detail later. So our hemopoietic growth factors, which prompt it to divide and differentiate. So remember, this is kind of what I had drawn a little bit earlier, where that stem cell is going to divide. Remember mitosis, separating the stuff in the inside, and then cytokinesis separating them into individual cells. One is going to go back up and be a stem cell again, and then this one's going to go down and go be other stuff. So it then divides and differentiates. One remains there, one moves on. So here we have our daughter cells. So the other daughter cell becomes either of two types of more specialized stem cells. So here's our hierarchy. One is our lymphoid stem cell. So over here, we're following the path of the lymphoid stem cell. And up here gives rise to a class of leukocytes known as lymphocytes. So you can kind of see where it ends up down here, lymphocytes, which include the various T cells, B cells, and natural killer cells. So B cells, T cells, and natural killer cells, which we'll talk about in a lot more detail in the white blood section, or white blood cell section. These all function in immunity. So if you can remember lymph, right? The lymphatic system is our immune system. Our lymphoid stem cell will be toward the making those cells that are part of immunity. So, however, hemopoiesis of lymphocytes progress somewhat differently from the process for the other formed elements. So our lymphoid stem cells quickly migrate from the bone marrow. So remember, we have hemopoiesis in the bone marrow. And so this section up here is in our bone marrow. Whoops. Bone marrow. Here in the bone marrow, actually even until we get to bloop here, well, that includes the myeloid, but here, the lymphoid stem cell, then this lymphoid stem cell is going to migrate from this red bone marrow, and it's going to go to the lymphatic tissues, including the lymph nodes, the spleen, and the thymus, where then this section is going to continue on. That's where that's going to happen, is in the lymph system. So we will talk about that a little bit later. A little bit more specificity though, B cells mature in the bone marrow and T cells in the thymus. Again, we'll talk about that later. So then the second, right, so we're coming here from this multipotent cell, the hematocytoblast, can either be the lymphoid stem cell or it can become a myeloid stem cell, depending on what the body needs, by the way. So if we need some more immune system cells, say you have an illness, then your body is going to go this direction. If you need to be making things like erythrocytes, or actually some of these are immunity as well, but for various other things, maybe you need more red blood cells, then it's going to go down this path and go the myeloid stem cell. So it gives rise to all the other formed elements, including the red blood cells, erythrocytes, megakaryocytes, that is the precursor to platelets. You can see here, we'll talk about that, and a myoblast lineage that gives rise to monocytes and 3 forms of granular leukocytes. These are these guys down here, and we'll talk about that. So we have our 2 options here. We're going to go from our hemocytoblast, right, which is in the red bone marrow, and it's going to go the direction of either a lymphoid stem cell or a myeloid stem cell. And we can come back to this chart when we've talked about all of these different cells as well. So it says here the lymphoid and the myeloid stem cells do not immediately divide and differentiate into mature formed elements. I'm up here. As you can see, there are several intermediate stages, as you could probably just see here. We've got all of these other stages in here along the way. And there are several intermediate stages, many of which can be recognized by their names and have the suffix blast. I think this is probably something that you may have already learned, but is also important. So blast, so for instance, megakaryocytes are the precursors for megakaryocytes. And pro-erythroblasts become reticulocytes, which then eject their nucleus and other organelles before turning into erythrocytes. So there's a pattern here. If it's a blast suffix, and if it is a site suffix, right? We have blast is a precursor to a site cell. So maybe that'll help you in the future to remember the difference between the two. So if you see something that ends in blast, you can remember, that's a precursor. And then when we're talking about the site, erythrocytes, that's kind of the end product. Although reticulocyte is kind of an egg product, but not very specifically. So we'll see that in just a couple of moments when we get to the red blood cells. So we have the hemopoietic growth factors. So remember that very first blood cell. I'm going to scroll back up here again. We talked about, I believe it was here. Yes, it is here. Let me see if I can do something different. I'll highlight here. So we talked about hemopoiesis, right? Begins when the hemopoietic stem cell is exposed to the appropriate chemical stimuli. And what we're talking about here are those hemopoietic growth factors. So now we're going to talk about those hemopoietic growth factors. So we're going to scroll down here to page 790 in our ebook and talk about those. So our first one, our largest one, the one we'll talk about the most, is erythropoietin, and we're going to see this growth factor as a very important one when we're talking about different processes. So, and even when we're talking about different systems, as you can see here, it is EPO is the shortened or is the abbreviation for erythropoietin. It is a glycoprotein hormone that is secreted by the interstitial fibroblast cells of the kidneys. So I was going to say we will talk about it more, not more detail. This is where we're talking about it in detail, but we'll mention it again, I guess, is my point when we talk about the urinary system, when we talk about kidneys. So erythropoietin is a glycoprotein. If you remember, glycoprotein, carbohydrate protein, hormone secreted by the fibroblast cells in the kidneys in response to low oxygen levels. So if you can think for a moment, if the body has low oxygen levels, the kidneys are going to pick that up, and we'll talk about how that works. And then it's going to secrete erythropoietin. And then erythropoietin is going to travel to the red bone marrow, and it's going to say, hey, we need red blood cells. So it's going to start hemopoiesis, right? Making of the blood. So it prompts the production of erythrocytes. Here it mentions how some athletes use synthetic EPO, erythropoietin, as a performance-enhancing drug. This is the blood doping that has been mentioned. Perhaps you've heard of it. To increase the red blood cell counts, to increase oxygen delivery to the tissues, can be banned. But more importantly, I think, it is used medicinally in the treatment of certain anemia to make sure that a person is producing enough red blood cells because their body, for whatever reason, doesn't get enough oxygen and is anemic. Specifically those triggered by cancer and other disorders that decrease this level. So erythropoietin, when we are talking about different processes in the laboratories, as well as on exams and such, you want to remember that when the body is going to be producing erythropoietin, it wants to increase the red blood cells. So remember, hemopoietic is making blood growth factors. EPO is a thing that's going to make blood, increase blood. The next one is thrombopoietin, another glycoprotein hormone produced by the liver and the kidneys, and it triggers the development of the megakaryocytes into platelets. We're going to talk more about that when we get to the platelet section. So erythropoietin should be pretty easy to remember because it has the erythro beginning here, prefix, meaning erythrocytes, erythropoietin. Thrombopoietin is going to match up with our thrombocytes that we'll see when we talk about platelets, which is also similar to megakaryocytes, or is part of the process. Next, we have our cytokines, which are also glycoproteins. They are secreted by a wide variety of cells, including the red bone marrow, leukocytes, the white blood cells, macrophages, another type of cell, fibroblasts, and endothelial cells. They act as autocrine or paracrine factors that stimulate the proliferation of the progenitor cells, and helping to stimulate both non-specific and specific resistance to disease. So we're going to talk about that specifically to understand what that is saying. There are two major subtypes of cytokines, known as the colony stimulating factors and the interleukins. So we can probably break that down a bit. So the glycoproteins, we know what that is, produced by these different cells that we have named here. They act as autocrine. If you remember, perhaps from your endocrine section in 271. Autocrine, meaning that it produces the cell, it secretes the cell and then it acts on itself. So the cell that secreted that hormone, or in this case the glycoprotein or the cytokine, is going to act on itself. Paracrine, meaning it releases it and it moves to somewhere else and acts on a different cell. And when it does its acting part, it stimulates the proliferation, so the making and the spreading out of the progenitor cells, progenitor meaning the beginning cells or the starter cells, and stimulates non-specific, which we'll talk about, which is kind of like a generalized, non-specific. It's not specific, and we'll get into more detail there, and specific resistance to disease. So we'll talk about that a lot when we talk about the immune system. But there are cells that will just go out and kind of kill anything in the body that's not the body, although sometimes it messes up. But and then there are the specific ones that only kill one certain kind of thing, like say one specific virus or one specific bacteria, versus the other ones that'll go out and take care of anything. So we're talking about that action, and we're going to talk about the two different types that do that type of thing. So hopefully you can go back, listen to this again, and make sure you're clear on what cytokines do, and then we can talk about the two different kinds, which are the colony stimulating factors, or the CSFs, and the interleukins. So our colony stimulating factors we'll talk about first. Again, glycoproteins, which we already knew because it's a cytokine, and we said that was already a glycoprotein. Acts locally, so as an autocrine or a paracrine factor, so it just kind of stays in that area, doesn't travel the whole length of the body. Some trigger the differentiation of myeloblasts. So if we remember back to that chart, you can scroll back to the hierarchical chart, the myeloblasts into granular leukocytes. So, and we're going to talk more about what those are in the white blood cell section. So we're getting a little bit ahead of ourselves on this one, but it's important to understand these growth factors so you know what is affecting what. So we start out with the erythropoietin, then thrombo, then cytokines. So here we are, the colony stimulating factors, or CSFs. They act locally. They take the myeloblasts and they differentiate a myeloblast into a granular leukocyte. So namely here, our neutrophils, our eosinophils, and our basophils. And I'm actually going to scroll back to that hierarchical chart for just a minute so we can take a look here. So remember, we're talking about our myeloblast, and that is going to go into our granular sites, which we're talking about specifically about these guys here. We're going to talk about our eosinophil, our neutrophil, and our basophil. So what we're talking about is this guy working on this, right? The CSF, working on this guy to differentiate into these guys. All right, so let's go back down. Here we are. So these are referred to granulocyte CSFs because it is going to differentiate into a granulocyte. A different CSF is going to induce the production of monocytes called monocyte CSFs. All right, so we're talking about a monocyte. I know we're going to talk about these in more detail, so it'll be really solidified. But when we're talking about a monocyte, we're talking about this guy over here. So our granulocyte, I'm going to shorten it here, granulocyte CSF, right, is going to work to make these guys, which are granulocytes. And then our monocyte CSF, our mono, is CSF, is going to work to make our monocyte here. So it's going to make this monoblast differentiate into a monocyte. Then both granulocytes and monocytes are stimulated by this GM-CSF. So G, granulocyte, M, monocyte. Granulocytes, monocytes, platelets, and erythrocytes are stimulated by the multi-CSF. All right, so if we can talk about those specifically, right, I'm just going to write kind of down here, since we're not going to talk specifically about the blood doping section down here. So we have the CSF, right, CSFs, and then in the CSFs, what we have are the different types of CSFs. So we have the granulocyte CSFs, which are going to make the granulocytes. Okay, if we can remember what those are, the neutrophils, the eosinophils, and the basophils. Then we have our monocyte CSFs. So monocyte CSFs, which are going to make the monocytes. And that will not make it, right? But you understand it's stimulating the process of then making this monocyte at the end. And then we have our GM CSF. They're pretty easy to recognize, right? Granulocytes makes granulocytes. Mono makes mono. GM, granulocyte, monocyte, makes these guys, right? Granulocytes and monocytes are stimulated by, so all of these guys. And then we have our multi. And multi kind of makes all of these guys, right? So the multi CSF is going to do the granulocytes and monocytes, platelets, and erythrocytes. So our granulocytes, monocytes, platelets, and, well, we'll just write red blood cells, erythrocytes. All right, so multi, many, does all of them. All right, so hopefully and remember, CSF stands for this colony stimulating factor, which is a cytokine, which is a hemopoietic growth factor. Okay? The next section, right, the next type of cytokine here are the interleukins. So the interleukins are another class of cytokine, which are the signaling molecules that are important in hemopoiesis. They were initially thought to be secreted uniquely by leukocytes, notice the leukin in there, and to communicate only with other leukocytes, and were named accordingly, the leukin part, but are now known to be produced by a variety of cells, including bone marrow and endothelium. So researchers now think that interleukins play other roles in the body functioning, so including differentiation and maturation of cells, producing immunity and inflammation. And so interleukins, you can remember, the interleukins are related to leukocytes. They're important in immunity, and they're also important in inflammation. And there are lots of different types of interleukins. Maybe you've heard of those before as being used medicinally, used in medicine. So they're generally numbered. The interleukins are numbered. Interleukin 1, interleukin 2, interleukin 3, etc. All right. So then we're going to move into bone marrow sampling and transplants for just a minute. We will talk a little bit more about putting blood into other people when we're talking about, I'm sorry, I'm losing my train of thought here, the blood types at the end of the chapter. And so this is kind of a little precursor, talking more specifically about bone marrow rather than blood cells, rather than what comes from that bone marrow, actually talking about the sampling of the bone marrow and transplanting the bone marrow when that's necessary. So sometimes it's necessary to order a bone marrow biopsy. So this is a test, a diagnostic test of a little sample of the red bone marrow. Or it's sometimes needed a bone marrow transplant, and then that's a treatment in which a donor's healthy bone marrow, so somebody that's healthy donates their bone marrow and its stem cells, right? That's the important piece here, is that the stem cells are going into the patient, which has the faulty bone marrow. So their stem cells may be cancerous, may have problems, may not be able to divide and differentiate. So the donor gives this healthy bone marrow to the person that has the faulty bone marrow. They assist in the diagnosis and treatment of severe forms of anemia. We're going to talk a lot more about anemia, such as thalassemia, major, and sickle cell anemia, as well as some types of cancer, especially leukemia. And we're going to talk about all of those at the end of the chapter. But at this point, since we're talking about hemopoiesis, which is what is done in the red bone marrow or in the bone marrow, there's a little mention here. So in the past, it just mentions that they would have inserted this huge needle into the iliac crest, if you remember where that is, in the pelvic bones, hopefully in the os coxa. And then they would pull this out and test it. Now, They don't have to do that, which is nice, or in a lot of cases they don't have to do that. They can just take a sample from the patient's blood, and then they can isolate those stem cells. If they require transplant, then a matching donor is matched up. We'll talk more about that when we talk about blood typing. And then the donor bone marrow stems are intravenously infused, which is nice because it's not as invasive. And then they establish themselves in the recipient's bone marrow, and then hopefully that is going to get around whatever problem it is, whether it's this thalassemia major, the sickle cell anemia, or different types of cancer. All right, so that's kind of that section talking about the growth factors, talking about hemopoiesis, or the production of the formed elements. And we will talk about hemopoiesis a little bit more in detail a little bit later, but that's kind of the basis of the formed elements. Remember, the formed elements include the red blood cells, the white blood cells, and the platelets. So the next section is actually going to be specifically this first type of formed element, which are the erythrocytes. And we'll talk about that in a lot more detail.